My name is Mark Komorowski. It is both a pleasure and an honor to be the 159th president of the Michigan State Medical Society. With apologies to Charles Dickens, it was the best of times, it was the worst of times. Over the years, those words have been spoken to express despair, but Dickens wrote A Tale of Two Cities based on his personal struggle with love, loss, and redemption. Today, as physicians, we parallel his work of art. The struggles we encounter in pursuit of a calling that we love so much, a slow erosion of the loss of autonomy through legislative mandates and payer idiosyncrasies. Today, we need to identify and blaze the paths of redemption that the calling we chose and tirelessly forge provides a better healthcare delivery for our patients. It was the summer of 1977, shortly after I graduated high school. I was employed as a ward clerk in the hospital I was born in. My assignments included working on a ward that was the home of the internal medicine residents. Someone asked what my career plans were, and I replied, to go to medical school. Instantly, I was met with a chorus of, "Don't, the golden years are over." Take a moment to process that. CMS hadn't developed a cauldron of alphabet soup acronyms. What was the worst of times then? Clearly, they were not burdened with an EHR, as the clerks did all the entry work. The HMO Act of 1973 was in its infancy, and DRGs wouldn't be seen until 1982. The concept of RBRVS ignited in 1992 with the ACA circa 2013, heralding EHR and VBP, also known as value-based purchasing. And now in 2024, we have PE, private equity. We are tasked with harnessing the ever-changing winds of healthcare delivery to navigate our future. It is wind that propels a sailing vessel, and no captain wants to be in irons, facing the wind without moving, or worse, having no wind at all. Movement is about controlling the wind, not changing it. Ask any seaworthy captain. One of those winds is the appearance of private equity that has brought much consternation. This has the potential to fill our sails when physicians have controlling power of such entities. The theme of redemption can be achieved. Here in our state, urologists have come together and developed a 65% controlling stake with Solaris Health Holdings and created Michigan Institute of Urology. This will help them with needed capital as they control overall cost of care. Dickens in 1859 wrote, "Things are not always as they seem, and there are bad outcomes from partnering if due diligence is not exerted." Advocacy is the foundation of MSMS, and through decades of tactical lobbying, compelling testimony, and physician engagement at the grassroots, we have achieved success with liability reform, prevented a Medicaid tax, and addressed prior authorization, to name a few. It was MSMS, spearheaded by Bush Ahmad, MD, that brought the IMG section to the AMA. We initiated the first AMA hospital medical staff section, now known as OMSS, with Henry Domzowski, MD, from Detroit, as its first chairman. MSMS was one of the first state medical societies in 1976 to start a physician-led professional liability company, now known as the Doctors Company. MSMS has always been a source of leaders, creators, and initiator of programs to help our physicians here at home and nationally. MSMS arose from humble beginnings on Walnut Street in Lansing with its first executive director, William Burns. The Yamasaki Building, as it became known, started in 1958 and was completed in 1961. We are fortunate to have a strong support staff led by, for the first time, a physician, Dr. Tom George. He has trimmed the sails of our organization so we can travel safely for years to come. Look around, my fellow colleagues. You are the soul of MSMS, but the voice is directly proportional to the number of physician members. We are 9,000 members strong. We need to be 12,000 strong, or 15 or 30,000 strong. Imagine the route this organization could take, representing all the physicians in Michigan. The influence we make real advancements in state and medical funding, health plan policies and reimbursement, patient and physician-friendly legislation, and regulatory advocacy that starts to eliminate barriers to practice. Faced with challenges ahead, none are insurmountable if we are all engaged. Let us pull one rope in one direction, so we may have future physicians remark, "It was the worst of times, and now it is the best of times." Thank you.